I'm going to give you a little bit of information I think is more thought-provoking than I am going to be giving advice or recommendations. And those of you who know me well, you know I'm a little bit pathologically contrary sometimes. I tend to change my mind as I see new things come along. So I really am quite flexible in my way of thinking. Now, I'm not going to steal the thunder because this is going to be presented in one of the next parallel sessions, but some great modelling looking at business as usual and smoking change in smoking prevalence over time. Essentially, if we're going to achieve the 2025 goal here in New Zealand, we have to really significantly increase cessation rates. And what do I say to that is, I'm not quite sure how we're going to do that. Now, looking at tobacco control strategies, I just want to point out that none of these things can operate in their own little world. You need everything. These are the two main legs, I suppose. I'm also just going to throw something into the mix, a third leg here about harm reduction and do we need it, should we be considering it? And indeed, is harm reduction the right word? If you're looking at the quitting process, this is what we're looking at clearly, from smokers making a quit attempt to achieving long-term abstinence. And remember that the health gains come from quitting smoking long-term. And there's a whole lot of factors that influence this, both the making a quit attempt, but also sustaining abstinence long-term. And we can't ignore these things, especially the social factors, which I think, and I have been guilty in the past of probably over-medicalizing smoking cessation. The more you work with highly dependent smokers from lower socioeconomic groups, the more you realize that actually you may have been wrong. Tobacco control policies, important in prompting quit attempts and also maintaining abstinence. And you've got your brief interventions and smoking cessation treatment. So it has to be all together. It's not either or, it has to be an and. And this is not rocket science, it might seem to be, but this is Robert West's first law of smoking cessation, which simply says to increase your number of ex-smokers in the population, you need to get more people trying to stop and try and increase the successful outcome of each of those quit attempts. Now, you could change either of these. You could just increase the number of people making quit attempts, and yes, lots will go unassisted, but if you just increase the overall number, then you will increase E. If you increase the success of quit attempts, then you can increase E as well. But really what we're looking at is more people trying and more people staying stopped. And this is where all these policy measures are incredibly important in increasing the N and prompting quit attempts. And we've got a wide range of these tensions and triggers in New Zealand. You're just looking at New Zealand smokers here trying to quit, where it seems doing quite well. And up around about half of all smokers are trying to make a quit attempt each year. Average number there of about 1.5. And some data from Ron Borland, which is, I think, incredibly important, that people are making quit attempts. They're probably making more than we think. A lot of the time in research, we use this funny definition of a serious quit attempt being at least 24 hours. But I think that many people actually go into making a quit attempt with some seriousness in mind. It's just that they don't manage anything past 4 hours. And they probably forget about these quit attempts that they've made at numerous times throughout the year. Rates of quit attempts are lower in some groups. In terms of increasing cessation support, we don't have any magic cures, but there are certainly some things that we can offer that make quitting more likely. And when you're looking at use of cessation services, again in the New Zealand setting, people are using things. And again, perhaps more than I would have expected. So, if we've got sort of half of the population trying to quit and a lot using some sort of support, shouldn't we be seeing more people quitting smoking? One may think so, but I think it's more complex than that. Now, sort of one interest of mine is sort of this harder to treat, and it's a bit of a controversial area. Some people say, yes, it does exist. Some people say, no, it absolutely doesn't. And as a clinician, I would say, yes, absolutely, I do see this, but of course I'm just seeing a certain group of people. But sometimes these smokers that struggle are defined as hardcore smokers, but actually hardcore really refers to those that don't want to quit smoking. And I don't really believe that that's the majority. I think the vast majority of smokers now actually want to quit. I've got so many pressures. But anyway, these hardcore smokers, if you like, do exist. They're a small proportion of the population, but they tend to be older, male, single, and from socially disadvantaged backgrounds. So is there evidence? Well, it's a bit mixed, I'm afraid. But if I just show you some examples of no evidence for this whole hardening hypothesis, if you're looking at, this is the quit ratio, US data, it's been relatively flat. So it doesn't suggest that less of the remaining smokers are not quitting. We're also looking at, if you look at cigarette consumption, which is a weak indicator of dependence, but you'd imagine that if you're left with, as more people quit, the smokers that found it easier to quit have already done so, then you'd be left with more highly dependent smokers that smoke more. This doesn't seem to be the case looking at cigarette consumption, but of course lots of other things reduce cigarette consumption, such as tax increases will drive cigarette consumption down. Some quitline data from here in New Zealand again. Judy Lee and Michelle Grigg looked at this in terms of dependence scores over time and found actually they were decreasing. There may be other reasons for that. For example, perhaps your most highly dependent smokers have tried quitline already and not going to ring back. I don't know. And things haven't changed greatly actually in the more recent data, so thanks very much to Rion for these. But there are some data that suggests that this population, the remaining population of smokers is becoming more dependent. Looking here, it's sort of country data, countries with the lowest smoking prevalence tended to have more smokers that are more highly dependent left. Paul showed some of these data in the beginning of his slide. If you take the behavioural interventions for smoking cessation back in the 1970s and 80s, quit rates were higher then than they are now. Now, that, I guess, maybe we're rubbish now at delivering behavioural interventions. I doubt that's the case, but it would suggest that perhaps our population is changing. Same for pharmacological treatments. So what do you make of all of these data? Well, there are some possible conclusions. One is maybe hardening, this whole so-called hardening hypothesis just doesn't occur. It's not happening. Or it may be happening, but there are other things that are going on that are sort of diluting this effect. Perhaps the new smokers are able to quit more easily and so come out of the equation, or your old hardcore smokers are dying off. Or maybe it's just that we're not using the right measures of all of these. And there's some new thinking in this area that goes beyond just level of dependence. This concept of positive identity. These are data from Robert West's Smoking Toolkit study in the UK, where you do have a group of people that say, yeah, I like being a smoker. That doesn't mean that they don't want to quit, although they are less likely to make a quit attempt. And it seems that smokers with positive identity may be less likely to succeed in quitting. And then you've got this population of people that have made numerous quit attempts over time. And this is actually quite a good indicator of how they might go in the future as well. Again, some more recent data from Ron Borland's team suggests that actually if you make multiple quit attempts, one after another, in a given time period, you're less likely to succeed. So should we really be bashing people over the head and say, don't worry, just keep on going, keep on going, keep on going? Maybe it's okay to say, hey, look, take a break for 6 months, recharge your batteries, and come back and do it again when you're ready. So I think we need to be a little bit more thoughtful about this whole quitting behavior. Do these people, or do some people get quitting fatigue? And then I really just want to finish off on this issue of smoking and socioeconomic group, because it's something I don't think that we've addressed quite well enough. And remember that people from lower socioeconomic groups are more likely to smoke, the much higher smoking rates, but they are just as likely to want to quit. They quit at try to quit at rates as high as those from higher socioeconomic groups, but they are less likely to succeed. So they're there, all these pressures apply to them, and they're trying to quit, but don't succeed so well. And if you look at some, more data from the UK, but I don't have any reason to believe that it would be hugely different to other countries. But if you're looking at long-term cessation by socioeconomic group, these higher, steeper curves indicate more cessation. So if you look at the higher socioeconomic groups, they've got these sort of two periods there in their lives where there's quite a high rate of cessation. So it's occurring in the underage of 30, and then again later on when you get a bit older, it's a bit flatter in the middle. But if you look at the other side of the graph from lower socioeconomic groups, you can see in that younger age group that it's much flatter. And this is suggesting that this is where the differences in quitting are actually occurring, in this younger age group, in lower socioeconomic groups. So I put it to you, should we be focusing more on younger smokers in lower socioeconomic groups? If you'd asked me this last year, I said, oh, don't bother with young people. It's such a hard task. Focus on the older age group. But actually, I think if we're serious about doing something here, we need to focus on this. And where are young people from lower socioeconomic groups? They're not going to see their doctors, especially young men. And we need to think a little bit about that and how we might tackle them. Yes, they'll go and see their healthcare services once they get a little bit older. And on that note, I'm going to finish there. I just want to leave you with a few key messages. I think that we need to be more considerate about looking at who we're trying to help to stop smoking and how we go about doing it. There's almost certainly no one-size-fits-all approach here. And these blanket measures, although they have a certain degree of effect, I think we could do a little bit more than we are right now.